There is perhaps no other time in the lifespan of a human where healthy eating is more important than during pregnancy and prior to pregnancy. Indeed, we now know that the nutritional choices a woman makes during her pregnancy, and again, even prior to, not only affects her health, but can affect the health of her yet unborn child over their entire life. And this is something that people don't realize. Meaning, we now know that the food choices you make during pregnancy can impact whether or not your child will go on to develop obesity, cardiovascular disease, type 2 diabetes, even some cancers. So the bottom line here is, Mama, you got the power. So I want to give you some guidance in pregnancy don'ts when it comes to food. So these are foods or categories of foods that you need to restrict or avoid if you want to increase the chances that you are going to produce the ultimate and a healthy child, okay? The first category of foods you want to restrict or minimize are what I call the great white hazards: white flour products, white rice, white potatoes, and sugar and sweets. The reason is, first of all, these foods have little little nutrients, at least compared to their more wholesome, whole grain, and real food counterparts. We know that those foods tend to trigger appetite, promote a sweet tooth. They have adverse effects on your metabolism, and they have adverse effects on the cells that line your arteries. So try to keep them to a minimum. Number two, you want to restrict saturated fats. You say, well, what are saturated fats? How can I learn that? It's really easy. You think four-legged fats. So fats in four-legged animals. So the food translation of that would be fatty cuts of red meat, whole dairy products, and butter. And, you know, at this point, we don't know of any benefit for our health for saturated fats. And we definitely know that they have adverse effects, primarily in what they do for your metabolism and what they can do to blood flow, okay? The third category of foods that you want to avoid are foods that contain trans fats. Trans fats are literally toxic molecules, right? No, I can't imagine that any woman during pregnancy would willfully take in a substance that was truly toxic. And that is what we now know about trans fats. Science knows no safe limits for any amount of trans fats. Where do you find it? This is a man-made fat, so you're only going to find it in factory, man-made, factory-made foods. So you want to strictly avoid stick margarine, shortening, and processed foods that list trans fats on the nutrition facts label. That's how you get trans fats out. It's very simple. The fourth thing is you want to restrict sugar-sweetened beverages. And I'm talking soda, fruit drinks, and sports drinks, unless you're really, really, really sweating a long time, like more than an hour, which you probably shouldn't be doing that if you're pregnant anyway. Why do you want to avoid these sugar-sweetened beverages? Because they have zero nutritional value, and they are definitely been shown to make it easier to gain unhealthy fat, right? These are what we call obesogenic beverages, and they don't have anything in them that is good for you. The fifth category of foods I want you to be careful about are ready to eat, like already packaged, refrigerated, deli-style luncheon meats, hot dogs, smoked seafood, unless you have reheated those things until they are steaming hot. And the reason is because those category of foods can at times harbor unhealthy bacteria that if you as a pregnant woman develop an infection with that kind of those kind of bacteria, it could actually lead to a miscarriage. It could kill your child or your fetus, okay? The next category of foods that you want to be careful of and actually strictly avoid are unpasteurized dairy products. And this would typically be things like soft cheeses like brie, blue cheese. And what you want to do here is simply look at the labels, and if you're getting any kind of dairy product, be sure it says pasteurized. Again, why? Unpasteurized dairy products may indeed harbor these harmful bacteria that we do not want you to run the risk of being infected with. It could actually kill your baby. Number 7, pregnant women need to avoid fish high in toxins. And that would be what we know as the carnivorous, longer-lived fish. Shark, marlin, tilefish, king mackerel, swordfish, fresh tuna, canned albacore tuna, and local freshwater fish. Completely avoid them during pregnancy. Those are the fish that are notoriously high in dangerous toxins, things like PCBs, dioxins, methylmercury. Again, these are substances that your fetus and your yet unborn child can be exquisitely sensitive to, and that can damage them permanently. Okay? Number 8, you want to avoid raw sprouts, raw or undercooked fish, meat, poultry, or eggs. The reason is, same kind of theme we've talked about. If foods of these categories may indeed contain a harmful bacteria, we don't want you to get those kind of infections, okay? The next is, I would stay away from liver. Who likes liver anyway? Ugh, yuck. Why? Well, in any animal, the liver is the organ of detoxification, right? You better believe that if you eat liver, the chances are you're going to be taking in some toxins. The other thing about liver that we're concerned about is it may, if you eat it a lot during pregnancy, you may build up too much vitamin A in your system, and that can actually also be harmful to a developing fetus. Next, alcohol. Please know, alcohol should be 100% strictly avoided throughout pregnancy, because we now know even small amounts may indeed increase the chances of fetal malformations and negatively impact the developing brain and nervous system of a fetus, okay? Lastly, caffeine, okay? Coffee, tea, diet, and regular soda that may contain caffeine. The studies are pretty consistent here. We tend to see a very regular, consistent association between caffeine intake in pregnancy and a higher rate of miscarriage, And again, it's such a, what is more precious than our children? And I don't believe in taking any chances. So my advice for any pregnant women is, just play it completely safe, be as perfect as you can, and try to avoid all sources of caffeine. Okay? So remember, mama, you got the power. You hold so much power. And what you do during pregnancy, as far as your diet and lifestyle, can have a lasting and permanent impact on the health of your child throughout their entire lifespan. That is amazing to think about. So make the right choices and do make a concerted effort to avoid the things or restrict the things that we just went over. For ICU, this is Dr. Ann.